Let's talk about neck pain. If anyone out there's dealing with neck pain, hopefully you can find this information helpful. Usually what we're going to try to do in the clinic is try to locate the source of the pain. If you're having localized pain on either side of your neck, left or right, we're going to check movement patterns and strength. If you're having pain that's radiating or traveling outside of the neck down into one of your arms, shoulders, arms, hand, we're going to do a series of tests to try to basically determine where the pain is coming from. So let's take a look at some of those tests and range of motion measurements right now. A quick series of testing that you can do on your own to try to determine if your pain that's traveling down the arm is actually coming from your neck basically looks like this. So the first thing we want to have you do is rotate to the side of either the neck or arm pain, like so, and then compare that to the other side. If it's painful to go to the side where your pain is traveling down the arm, or that motion's more limited, that would be considered a positive test. Another test you can do is called Sperling's test, which is a compressive test. Same thing, you're going to side bend towards that side of pain, put a little bit of pressure down through the neck, and then repeat on the other side. And again, if it's more painful to that radiating side, then that would be a positive test. Third test we can look at is a test for nerve tightness or nerve tension. So again, if your left side is where you're having the symptoms, you're going to want to bring that arm out, extend the wrist back, and then side bend or look away from that side. If that increases your symptoms, then that would be a positive test. And then the last thing you can do on your own is a little bit of a self-traction test. Basically using your hands, you can come in on your jaw and the back of the head and try to provide a force upwards, like so, okay? Another way to do that is lying down with a towel, or you can have somebody help you with that. If that test reduces symptoms or makes you feel a little bit better, then that would be a positive test. If 3 or 4 of those tests that you just did on yourself are positive, then it's very, very likely that your pain that's traveling down the arm is coming from your neck. Now, if your neck pain is just localized to the neck itself, either one side or the other or both, then you really want to try to look at range of motion or movement patterns. So what we want to look at again are those rotations, side to side. Right? How do those feel? Extension and flexion. Okay, do those reproduce any pain? And then a good side bend, side to side. If either of those motions cause localized pain to any area of the next step would be to try to kind of palpate it along the muscle. You can use your own hand for that. Try to identify any significant painful points or tight points. If you look forward or to the side and you feel pain in a particular area, when you go in there, it should be a little bit more sensitive, okay? What you can do using your hand is apply a little bit of pressure into that area and then try to go through some active movement, right? That might be a little bit sensitive, but that's a really, really good way to get a tight muscle to loosen up. I usually tell my patients to use some form of heat prior to doing stretching if it's a muscular problem. A few extra minutes in the hot shower can be good, or certainly if you have a heating pad, that works as well. Try to heat, follow that up with some range of motion or some stretching, and see how you feel. There are some self-traction techniques. There's a lot of stability exercises that we can get into. We'll save those for another video because I don't want to keep this one going too long. As many of you know, we've kind of limited our in-clinic care with everything going on with the coronavirus. We're offering some telehealth services or e-visits, which basically is a video conference with myself or Bridget in the Terryville office. If you're having any difficulty, you got some stuff going on, and you'd like us to at least be able to take a look at how you're moving and possibly take you through some self-testing that we can watch, we can get a better idea of where your symptoms are coming from. Hope you find this information helpful. Thank you for watching, and don't hesitate to reach out with any questions. Thanks.